Certainly, the news that we've been releasing over the recent days has not been the best, and we're going to certainly have to discuss what the next steps are for the country. The minister will give an update from her ministry, and the chief medical officer joins us here today to answer any questions. Following the Minister of Health and her speech, I will give an overview of where we are as a country and detail the changes which the cabinet has discussed this evening to put in place for at least the next 2 weeks. So we will start with the Minister of Health. Minister.
Good evening, Bermuda. The marked increase in the number of positive cases of COVID-19 over the last few days and weeks has in turn had a ripple impact on our community. We have seen an increase in the number of businesses affected, an increase in the number of people who are close contacts of cases, and a general sense of rising anxiety amongst our residents. I hope that by addressing you tonight, I will be able to answer your questions and address any confusion regarding the current health protocols and regulations. And as you heard from the Premier, we are also joined by the Chief Medical Officer, Dr. Ayo Oyinloye, who will also be able to provide any type of answers to questions. Over the past week, Ministry of Health has implemented several changes to try and stop the spread of COVID-19. On Tuesday, I announced that we had amended our health regulations so that it is now an offense to not wear a mask in accordance with the guidelines. A person who fails to wear a mask when one is required commits an offense and is liable on summary conviction of a fine of up to $500 in respect of the first offense and a fine of up to $1,000 of a second or subsequent offense. If anyone is confused regarding when to wear a mask, please visit coronavirus.gov.bm and read the guidance regarding mask wearing. To be clear, if physical distancing of 6 feet cannot be maintained from others, you must wear a mask unless you are at home, you're with members of your household while eating or drinking, doing high exertion exercise, and that I would recommend that you look at the gym guidance, or any child who is under the age of 2. And likewise, the guidance provided for that also exists. This mask requirement includes, but is not limited to, workers of all workplace premises in accordance with workplace guidance. Passengers on board public transport or in taxis must wear masks. Any person visiting any establishment, whether indoors or outdoors, such as a grocery store, a shop, a bank, or an office, and otherwise allowed by specific guidance, such as in dinings or gyms, as well as in public places, streets, or parks, when other persons are present and 6 feet distance cannot be maintained. Additionally, as of Friday, December 4th, we have mandated that a pre-arrival test must be taken within 5 days before arriving to Bermuda, not 7, as was previously the case. This will reduce the time period in which a traveler could have potential exposure before boarding their flight to Bermuda. Furthermore, on the topic of travelers, the ministry has developed a new traveler continuum that provides more clear direction to visiting and returning residents during their first 14 days of stay or on return to Bermuda. And the protocols are captured in the traveler's first 14 days, and it seeks to balance the need to manage the risk of transmission with the requirement to bolster our very fragile economic recovery. For those who have a negative pre-arrival test as well as a negative on-arrival test at the airport, the new guidance clearly states that those persons can take public transportation, dine outdoors, or dine indoors only at the hotel where they are staying, go shopping, enjoy outdoor activities, and work remotely from home. They cannot go to work and attend in-person meetings, participate in church services, dine indoors at restaurants that are not located in the hotel where they're staying, go to the gym, attend a permitted large event or other events such as house parties, birthday parties, or funerals, or attend indoor events generally. When those travelers have had a negative day 4 test result, they can dine indoors, attend permitted outdoor large events, but still cannot go to a gym or play a contact sport. For those travelers without a pre-arrival test, they are tested on arrival at the airport and must remain in quarantine until receiving a negative day 8 result. After the negative day 8 results is received, all travelers can then go work and attend meetings, go to school and daycare, enjoy the movies, and attend church services. And a negative day 14 test result is required before any travelers can use the gym or play a contact sport. For those travelers, the testing regime of on arrival and then additional testing through to day 14 continues to apply. And it is hoped the clarity now provided around what activities a traveler can engage in during their first 14 days of stay on island is helpful. And this graphic can be found at the website at coronavirus.gov.bm. On Friday night, I served a closure order to the Southampton Rangers Sports Club. And last night, I directed the Bermuda Football Association to postpone all football games. I did this because as investigations into current cases continues, the number of cases has increased tremendously and the risk of transmission that increases with large gatherings of persons. This is currently a temporary cautionary measure to allow the ministry's contact tracers to an opportunity to assess the situation. And I'd like to thank the BFA for their assistance in this matter and fully appreciate their understanding. As of yesterday, December 5th, 2020, bars and clubs are now required to close at midnight rather than at 2 a.m. as was previously permitted. Additionally, and for the avoidance of doubt, no business or facility may sell or serve intoxicating liquor between the hours of midnight and 8 a.m. With the increase in locally transmitted cases of COVID-19, we felt it prudent to amend the regulations to minimize the time where people may be socializing together. On Saturday, the Ministry of Health advised members of the public that any individual, who attended the funeral of Charles Henry Eugene Eberly on Saturday, the 28th of November, 2020 at Malabar has been since tested positive for COVID-19. And we advised any member of the public who also attended this event to call the COVID-19 hotline to arrange for COVID-19 testing, which took place this afternoon. We are issuing this advisory out of an abundance of caution as the most expedient way to contact all those individuals who may have attended the funeral and came into contact with the positive case. And this brings me to the topic of close contacts. I want to reassure the people that their information will be kept private. It is only used for outbreak investigation. Cases are allocated a case number, and that is how they are referred to during internal discussions. Also, we do not release information on the specific businesses that are affected by a positive COVID-19 case unless there are public health concerns. If a business, however, chooses to release their own information, that is their decision. Having said that, I would like to ask persons who are contacted by our contact tracers to please be forthcoming with information as it pertains to your close contacts. We need this information to be able to trace the potential spread. That information could help to save a life. We currently have 63 total active cases, 16 are imported, 30 are local transmission, and 17 are under investigation. Of those which are local transmission, 12 are household contacts, 14 are workplace contacts, and 4 are other or social contacts. I would like to reiterate that if you have been placed under quarantine by the Ministry of Health, you need to stay quarantined. You are not released automatically after testing. You are released only after your assigned contact tracer contacts you. I wish to remind people to keep their bubbles small, their social bubbles small, and to always wear your mask when out in public or around others from outside of your household. Also, please take all precautions while at work. You don't know where your workplace colleagues have been, so please don't let your guard down. Wear your mask, practice physical distancing, avoid meetings in person, work from home if you can, and avoid communal areas. I will provide a further update with respect to our testing schedule as well as any other cases and updates at our Tuesday press conference. Thank you, Premier.
Thank you, Minister of Health, for that comprehensive overview. And again, I want to certainly thank your teams who have done fantastic work, but it is unfortunate that the situation is not improving as quickly as we would like. Your team's certainly working the long hours, but as you had just mentioned, there are 63 active cases. And following meetings over the weekend and a cabinet meeting that concluded about an hour ago, we have determined that the circumstances on the ground are necessary for us to implement some of the rollback provisions of which were outlined in May, and to ensure that we can check and contain any possible outbreak of the virus. So unfortunately, this means that we are going to have to re-implement some of the restrictions which all of us, including myself, thought were long gone. This decision, without question, is not taken lightly. We will certainly continue to be guided by the advice of the Ministry of Health that uses a thorough, comprehensive, data-driven, and scientific approach as they guide us through this pandemic. And I want to recognize certainly the Chief Medical Officer who has assisted in that and made sure that what the decisions that the cabinet and the government are making are advised by what the data is showing on the ground and not what sentiment may feel. Earlier this year, at the start of the pandemic, the government had set out the threshold for rollback. One of the thresholds were 35 new cases per week. And with the increase in cases recently, we clearly have exceeded that measure at this time. Additionally to that, one of the overall aspects which we laid out for our management of the virus, because it's important to note that as with all countries, we're going to have to live with the virus. One of the things of which we wanted to specifically prevent was the overwhelming of our healthcare system. Our hospital is in decent shape. There are only 2 persons that are currently hospitalized, 1 person in critical care, and I know that our thoughts and prayers are with that individual. But what I do want to state is that the teams under the Ministry of Health who are required to make sure that they can capture and contain and to inform and to contact trace, those teams are now becoming stretched. And it is that something that can lead us to a dangerous place as we go forward. Therefore, it is necessary to impose the following restrictions to contain the spread. Therefore, as I said, rolling back a particular phase that's starting on Tuesday, December 8th, all indoor bars and clubs will be closed. Outdoor bars will be able to remain open. There will be no indoor bar service at restaurants. There will be table service only. And indoor dining will be for food service only. Therefore, restaurants will not be able to turn into clubs in the evening following food service. Group sizes at tables for indoor dining will need to be reduced as well. Gathering limits will be set back to a maximum of 20 persons per gathering. 20 persons maximum size outside of an approved exempted event. Churches will revert back to 20% capacity. Given the number of workplace clusters, persons are recommended, if they are in a tight workspace, certainly if you're able to work from home, you may want to consider working from home. Gym employees are required to wear a mask, and it's important that social distancing continues to be maintained inside of gyms. I reiterate that these restrictions will come into force from Tuesday. The Minister of Health has confirmed that these measures will be in place until at least Tuesday, the 22nd of December, and we will continue to assess the situation. Our goal with implementing these restrictions is certainly to reduce the spread of the coronavirus in our community. Together and individually, we must do everything that we can to contain the spread. As I said, our goal is to protect our healthcare system, and these steps are certainly necessary to do such. I know and understand without question that there are economic consequences of these closures. What I will state is that the Minister of Finance will make funds available to affected businesses. And we will support employees who are in these affected businesses with the supplementary unemployment benefits. We spoke earlier this weekend, and those funds will be made available, and the details on how those funds can be accessed will be shared this week. I do recognize there are economic consequences for businesses, and I do recognize there's economic consequences for individuals, but we are going to provide the assistance which is necessary. As the minister has said, I want to thank the Bermuda Football Association for working with us regarding the postponement of games. We are going to be working with not only the Bermuda Football Association, but all other sporting organizations that have sport events that are supposed to be taking place this month to make sure they can be handled in a safe manner. And we are certainly going to be working with our testing teams to ensure that all players, coaches, and staff referees can be tested so that we can make an assessment on whether or not the season can continue after the break. Regarding large group exemptions, and this is something, as we had said, that the groups are going to be cut down to 20 persons. Ministry of National Security will advise that all approved applications for large gatherings, those events will be requested to be postponed, and the approval will most likely be rescinded, and persons will be asked to postpone their large events. No applications for large gatherings will be accepted until further notice. And it is important to remember that the size of group gatherings has been reduced to 20 people effective Tuesday, December 18th. I know that for many, this news is difficult, and it is incredibly difficult for myself as Premier of this country. None of these decisions are easy, and no one is more disappointed than me that we need to be moving backwards. But these steps must be taken at this time. We understand where we are in the year. It is December, and we want to have, I would say, a semblance of a holiday season. It is critical that all of us obey the rules which have been laid out. There is no question at all that masks are the #1 proven method in order to reduce the spread of the coronavirus. It is essential. And so between the masking, between the physical distancing, between the restrictions, I am hopeful that we'll be able to see a changing of the trend. It is also important to note that we test far more now than we did in April or May. We have incredible testing capacity that is being put to use, and that means that we are able to identify almost as many positive cases as we're able to identify. Previously, in April, when there are persons who are presumed to be positive, but they're already quarantined, and there were limited testing resources, those persons were not tested or confirmed. Now we know and we understand the persons who are positive. And so I want us to make sure that we are mindful that we're going to be able to see the results very quickly. But it is very, very, very important for all of us to continue to maintain our vigilance. As the minister indicated, there is additional testing capacity, which is going to be brought online. So there's going to be more tests that are going to be available, and persons will be able to avail themselves of the testing, which is going to be able to help us to identify where pockets of virus may exist. It is unquestioned that, again, we must be called to come together and to work together. None of these steps are easy, but we can all control this virus if we all do what is necessary. We must do everything in our power to protect our seniors, the vulnerable, and those who have weakened immune systems. It is essential that we do not forget the basics. We will make it through this, Bermuda, I am confident. And like the rest of the world, Bermuda will be living with the coronavirus for some time. Each of us has a critical role to play, and we must continue to be responsible and comply with the public health regulations to support the well-being of our island. As I stated, the government will continue to closely monitor the island state and take the necessary decisive actions in order to keep people of Bermuda and our island safe. We have the capacity to deal with this. We have the teams to deal with this. We are certainly doing our utmost and level best to deal with this situation. It is unfortunate that it has got here, but I have complete confidence in the teams at the Ministry of Health to make sure that they can stay on top of this. And I would ask everyone to support our healthcare workers, those are the teams in the Ministry of Health who are doing what is necessary to contain this virus. There's one thing that you should know. There is a wall between the Ministry of Health and the rest of the government. And the information that is gleaned by contact tracers is kept completely confidential. In an earlier meeting, I was heard that persons are not giving information because of the fear that this information may be used for other types of purposes, whether it be enforcement purposes, police purposes, other things, etc. That is not the case. There are messages going around that are listing contact tracer numbers and saying, if this person calls that we cooperate with them. Understand, no information that you will give to a contact tracer will in any way, shape, or form, it cannot be used in any way, shape, or form for any type of action that may happen to you individually at a later point in time. That information is kept sacrosanct, it is private information, and the contact tracers will use that information to ensure that they can constrain the spread of the virus. So please cooperate with the contact tracers. We're working diligently to make sure that we can contain this virus. With that, I'm happy to answer questions, and I know that members of the media have submitted a number of questions, so we'll answer your questions at this time. And also, I know some people are tuned in on live. Please feel free to submit your questions, and we'll try to answer them. Just so we're clear, Tuesday, December 8th, not 18th, in case I said it. Tuesday, December 8th.
Good evening, Premier. We have questions from various media outlets. I'll start with the Royal Gazette's questions. Could the Minister of Health give more specifics as to why football was shut down? Are there any links from the recent uptick in positive cases?
Thank you, Natasha. As I indicated in the statement, we basically needed to take a pause. The contact tracers, as the Premier described, are extremely busy. They play a critical role in our surveillance and assessing where the community is with respect to transmission of the disease, of the virus, excuse me. And again, I'd like to thank the BFA for their cooperation. Contact tracing is an ongoing process. I've described it before as peeling back the levels of the onion. And as we were doing that, we required a pause on football and large gatherings associated with football whilst the contact tracing, that vital, important role could be carried out.
Thank you, Minister. Next question from the Royal Gazette. The number of positive cases does appear to be snowballing. Furthermore, there appears to be an increasing number of positives that have been spread by local transmission rather than being imported. So at what point will government be considering another lockdown? We now have 63 active cases. How high does the number have to reach before government introduces curfews or shuts down the airport or what have you? What's the tipping point? And that's a question from the Royal Gazette.
I'm happy to answer with that. We are guided by health advice. And what I would state is that we have all of these things in place to make sure that our healthcare system can remain intact. There is a little bit of strain in our healthcare system, as the minister has said, that we needed a pause. I'm confident that we're going to be able to have the testing capacity and others, but we are now at that stage. And I think that everyone can look at the coronavirus.gov.bm website. It lists the certain indicators which are in place where we might have to consider rolling back, and we have met some of those thresholds. So that's the reason why we are implementing some of these rollback provisions to give ourselves some time to breathe and to make sure we can get on top of any particular cases of the virus.
Thank you, Premier. The next question from Media Maya. Why isn't there a consistent message when it comes to quarantine and level of exposure? In the Minister of Health's ministerial statement on Friday, there wasn't a clear understanding of what you can do and what you cannot do between your results. Will there be a graphic made so that it's easily understood? Sorry, go ahead, Minister.
That's right, thank you. Yes, when I described in the ministerial statement on Friday, the 14-day traveler continuum, we broke it up into what you can do on your arrival, what you can do on day 4, day 8, and day 14. That document there is like a graphic illustration of what you can and cannot do depending on the day of travel and the travel continuum, which is on the website. That graphic has been produced and is on the website.
Thank you, Minister.
If I may, I think it might be a good time for the CMO to speak about how every case is different. And I think that that's important as well, because the confusion sometimes lies in persons assuming that all cases are the same. And I think the CMO, who gave a very good outline to the cabinet earlier, might be able to help to elucidate the public on that.
Thank you very much, Premier. You're absolutely right. Every case, every cluster is different. And the first part of the question that Ms. Wilson read out was, where isn't there a consistent message when it comes to quarantine and level of exposure? And there isn't a consistent message because every case is different. We contact tracing team looks at every exposure and everybody who's tested positive. We try and find out the close contacts associated with that person, and our public health advice is guided by that. And agree with me that there are no two cases are the same, and therefore our public health advice is tailored to meet the risk assessments that we give. So it's impossible to give a consistent message around quarantining because the risk assessment is different, exposure level is different, the context is different. Thank you.
Thank you, CMO. I'll go to the next question from Media Maya. Where does the government stand on the possibility of an anti-vaccination and mask march in Bermuda? How will a march like this be addressed? Will the government allow it? A, what safety measures will be put in place for those who may have to intervene in a march like this?
I'm not going to necessarily comment on things which may or may not be done. I'm just going to remind everyone of the importance of wearing masks and the reason why these public health interventions have been put in place. And so on that matter, I know that there's a number of pieces of speculation and forwards, but I'm going to encourage every single person in Bermuda to follow public health guidelines. And maybe Dr. Io can take this time and opportunity to speak to why masks are so important and some of these misconceptions which are coming up. I mean, someone today was saying that, how come when you get the flu, you always get sick, but when you get coronavirus, you don't always get sick, and this doesn't make sense. And there's so many different conspiracy theories flowing around. I can assure you that we don't sit around here up all night and doing things like this because of conspiracy theories or because we're making this stuff up. It is real, it is having real impacts, and it's something that's very important for us to control. So I don't know if you want to say anything, Dr. Io.
Yes, absolutely, Premier. I would. First thing to say, for the avoidance of doubt, masks work. When people, this virus is a new virus. We haven't seen this before, and we're learning more and more about this virus every day. I think the latest figures is saying about a third of people who have this virus may show no symptoms at all. So they may be carrying this virus and spreading it out to other people. And the way the virus is spread is primarily through respiratory secretions. So when we talk, when we sing, when we shout, we are projecting micro droplets from our mouth and sometimes through our nose out. What masks do is, especially if you wear a mask with at least 3 layers, is that it stops that from spreading to other people. It's not 100% protection, but it drastically reduces the amount of viruses that you can seed out that other people can be able to pick up. And that's the crucial way it works. New evidence is also suggesting that the mask also protects the wearer rather than other people around them. So it's a win-win situation for you if you wear masks. You are not likely to be able to spread the virus, and 2, increasing evidence suggesting that you are less likely to be able to get a large dose of virus that could cause you illness. So masks work. If anything, please wear your mask. If you're not able to maintain your distance, please wear your mask. It's absolutely crucial. Thank you.
Thank you very much, CMO. I'll go to the next question from Media Maya. Very often, the Minister of Health has explained that the uptick in cases is largely due to overseas numbers increasing and people entering Bermuda, imported cases. Therefore, how will the early closure of bars help in reducing COVID-19 uptake cases?
that question is very important because we know that COVID gets here, it has to be imported. So obviously it's getting here through the airports, and we've indicated previously because we've seen an increase in transmission levels at our major gateway cities, and clearly it's not surprising that we would see cases imported in Bermuda. However, in addition to what the CMO was saying with respect to masks and the importance of masks and how much it can reduce transmission levels, et cetera, the fact is that when we are consuming vast amounts of alcohol or any alcohol for that matter, oftentimes people during the course of that socialization exercise lose inhibition. So they're less conscious about, if they're not drinking, putting back on their mask or stepping 6 feet away from persons, and they generally seem to congregate. Oftentimes, if you've gone into a bar or a club, it's very noisy. So in order for people to be heard, you might have a desire to remove your mask so that you could be speaking, or alternatively shouting, which of course is going to have the transmission of the droplets that the CMO just spoke about is more likely because you're shouting and exerting more energy and you're exerting more energy in your speech. So the reality is that we felt that because of the inhibitions that are associated with alcohol, the fact that people are less likely to remember to physically distance, wear their mask, and all those mitigants that we've spoken about, that it would be important for us to address the issue, the social setting where we're seeing more cases.
Thank you, Minister.
Can I just add to that, Aderonke?
Sure.
Just to support what the minister said, there's plenty of international evidence and research, and some of the local findings that we have on Ireland suggests that precisely what the minister described. The alcohol is a social lubricant, but it also causes people to lose inhibitions, and they're less likely to take the precautions they would take normally. And we have ample examples of that on Ireland at the moment. So it makes absolute sense. Anything that reduces the duration of people coming together, participating in high risk activities like shouting and not maintaining physical distancing would help. Thank you.
Thank you, Dr. Ayo. We'll now go to questions from Bermuda Broadcasting. The first question: many Hamilton bars and restaurants were packed on Friday evening, both outside and inside the establishments. Scientists have been warning that gathering in close proximity without masks carries heightened vector risks. How do we realistically keep establishments open so that these businesses can survive by allowing the public to eat and drink with masks off and guests and patrons sitting elbow to elbow, whilst at the same time trying to suppress a growing second wave of infections in Bermuda? That's from Bermuda Broadcasting.
Well, I think that's a very important question. And I think part of what the CMO just spoke about explains the rationale behind the restrictions with respect to closing back the bars by a couple of hours. And what we're trying to do, as the Premier has indicated over and over again, we have to strike a proper balance. We understand that there's a public health pandemic that's currently occurring in Bermuda, and we're seeing increases of cases. Yet on the other hand, we need to try to strike the balance of making sure that our economy, as best as possible, can continue to thrive. By combining the two, we felt that the best method at this point would be to just roll back for a couple hours the hours of operation with respect to the bars and the nightclubs. As the CMO just said, it is a high risk activity, and the longer you stand at a bar and the longer you consume alcohol, the more likelihood is you're going to have increased inhibitions and you'll continue to carry on that high risk activity. So our thought processes was to try to strike the proper balance between continuing to allow the economy to thrive, yet at the same time ensuring that we do as best as possible to mitigate any further transmission.
Thank you, Minister. The next question from Bermuda Broadcasting: how is Bermuda now? Is Bermuda now experiencing community transmission?
CMO?
I can answer that. Yep. Thank you, Premier. No, as the Premier mentioned earlier on in his opening remarks, we are not yet in that uh, situation, thankfully, and that's because there are several aspects to this. The number of new cases is the one thing, and the others is the amount of our ability to be able to deal with that. Thankfully, we are in a good position, but we may not remain in that position if the numbers continue to rise at the rate that they're rising. Hence, the reason for us to put all these measures in place. So no, we don't have, we're not yet in what WHO will term community transmission.
Thank you, Dr. Aya. And our last question from Bermuda Broadcasting. How many contact tracers are currently at the Ministry of Health?
Okay, I can also answer that. We have 14 full-time contact tracers and 3 supervisors at the moment, but they're working flat out.
Thank you very much. This next question is from TNN. And his question is, why is it that a large group of people are being held hostage that attended a funeral last week?
I wouldn't say that they're being held hostage. I'm afraid that I wouldn't agree with that adjective. I think what's critically important is that Bermuda itself, if we are in the midst of a pandemic, and the reality is that there are certain mitigations that we must adhere to in order to not only overwhelm our healthcare system, but also have unfortunate death. The reality is that we've seen all over the world, and we've seen in Bermuda, that this pandemic does kill people. And if we have to take steps that will help to mitigate against that, then we have to do that. So calling people that have been in close contact with a person that is a positive case, requiring them to quarantine, requiring them to get tested so that they know their status, so that they don't in turn pass on their illness to other persons that may be far more vulnerable. You've heard the CMO speak about already, almost a third of persons that contract COVID are asymptomatic. So by the government taking steps to try to minimize the adverse impact of COVID spread and transmission, which could cause an overwhelming of our healthcare system and death, is not being held hostage. We're trying to do what a responsible government would be doing.
The next question from TNN. TNN understands the majority of persons there are testing negative. What is their next course of action? How long will it take for them to return to work? I'm assuming the references to those who attended the funeral?
Right. As I think I said in my statement, and perhaps the CMO can elaborate on it, the contact tracers and the case managers are the ones that will be in contact with individuals, and more information from the Ministry of Health will be delivered to individuals that potentially attended that funeral, whether it's done individually, because in some cases it is, or through a public notice, but more information will be revealed in the newness of time. We won't hold people to ransom in suspense.
Yeah.
CMO, do you wish to add anything?
Yeah, absolutely, Premier. So basically, the details of that depends on when we have all of the tests coming, and that will help us to understand what level of risk we're dealing with, and if we put in more public health measures. So as the minister said, these individuals will be contacted by the contact tracing team, and they will be advised about the next steps. So listen to the official sources. Please don't listen to social media when it's not coming from the official sources or gossip. We would ensure that we communicate with you, and you get to hear the right information from official sources.
Thank you. Another question from TNN. He's asking, what is community transmission? He's asking for a definition. CMO?
You might be on mute, CMO.
You're mute.
Hello, I was just going to quote the exact definition for you.
Okay.
Just give me a minute while I get that up.
But I think it's important to note, it is able to be found on the World Health Organization website, And the
Yeah.
fact is that Bermuda is not at that point.
Correct. Yeah, so it's low incidence of locally acquired, widely dispersed cases detected in the last 14 days, with many of the cases not linked to specific clusters. Transmission may be focused on certain population subgroups and low risk of infection for the general population. But crucially, it does then go on to define what the criteria is for in specific groups that will allow you to be able to know if you are in different levels of community transmission. All this information is available on the WHO website.
Okay, and I think this may be our last question from the media. Can you, and this is from Bermuda Real, can you clarify what is the procedural requirements for returning residents by the airport? Are they required to be pre-tested or not? And what are you saying about closing our borders? That's from Bermuda Real.
For residents that are returning to Bermuda, there is a requirement for them to take a test upon arrival. If they do not have a pre-test, which we are strongly urging persons to take prior to arrival, then they will be required to be fitted with a monitoring device on their wrist, which requires them to be in quarantine for an 8-day period. I don't remember the second.
The second question was in regards to our borders. The borders situation remains as it is. There's going to be, as the minister has indicated, additional tightening regarding the traveler continuum. There may be additional changes which are being put in place. Our biggest challenge right now, of course, are the local transmission cases, not necessarily for the imported cases, which we're able to catch and manage relatively well.
Thank you, Premier. Thank you, Minister. We'll now take some questions from the public that have come in via social media. And
if I may, Adirondack, before you get there, I know that there's a number of questions about schools. And I just want to state that, as Dr. Iova says, that each case and each situation is handled differently and separately. I will just say from this that I will close bars, restaurants, and other things. But the most important thing to do is to make sure our students can continue to get an education. I know that, and I want to thank our teachers. I want to thank all of our administrators. I want to thank the healthcare professionals who've been working with the schools, the school environments to make sure that they remain safe. We did lay out some matters which will take place last week, where we said that if there is a confirmed case inside of any school establishment, that school will immediately suspend in-person classes so that the Ministry of Health can conduct an assessment and can advise. But one of the things that is important to note is that we are continuing to make sure that we can put the education of our students first. So we are going to continue on that path. And if there are individual cases which come up, we will then make decisions based on the individual information that presents itself.
thank you, Premier. A question from a member of the public. Does the government have any update on when the UK could be delivering the vaccine to Bermuda?
Yes, we, from our last correspondent with Public Health last week, they indicated that at the best case scenario would be sometime in mid-December, that we would be able to receive the vaccine from the United Kingdom. I think CMO could probably add to this. I understand that it's going to be shipped to the United States so that it would be quicker for us to get it here as opposed to going through the United Kingdom. We also have the COVAX facility that we've also secured. Once that becomes available, we'll be able to receive the vaccine through that particular mechanism. So we've looked at two parallel options, and we're anticipating that we will have the vaccine as early as December, and that we will then start distributing the vaccine to those persons that are healthcare workers, as well as our more vulnerable populations, such as seniors and persons in residential care, rest homes, excuse me.
Yeah. So yeah, I can add to that, Honorable Minister. So the Honorable Minister's right. It's just important that I emphasize that the only vaccine that has had approval from the regulatory bodies is the Pfizer BioNTech vaccine. So that's the only one that had approval just yet. And the minister's right, the vaccine is at present being manufactured in the United States and also in Germany. So from the UK government, we have received assurances that we will be getting some from the week anytime from the week commencing 14th of December. The exact details still needs to be worked out. There's still issues around the transportation that needs to be worked out, but we expect to get our supplies from the United States because that's closer to us rather than it first going to the United Kingdom before coming to us. So yes, we are anticipating that this will come quite imminently, and Minister has also expressed the prioritization schedule for administering this vaccine. If I may just add very briefly, if you once the vaccine arrives, if you are offered this vaccine, I would strongly urge everybody to take this vaccine because that is our best chance at the moment to control this pandemic.
Thank you very much, Dr. Ayo. Another question from a member of the public. Will there be restrictions placed on grocery stores since there are large crowds there daily? Will there be dedicated shopping days again?
As the Premier announced a little while ago, what the potential restrictions are going to be commencing on Tuesday, that one with respect to the returning of the ABC, so to speak, shopping days is certainly not something that's been considered at this time. And our hope is that with the mitigants that are going to be commencing on Tuesday, that we will see improvement in our real-time numbers and our numbers that we're seeing of positive. So at this point, that's not a matter that's being considered.
And so will there be restrictions on travelers? Another question. On travelers coming to the island, would you be placing additional restrictions?
We've outlined the traveler continuum. The minister's outlined that fully, and she said that that's coming into effect with the wristbands, with the specific restrictions, with the enhanced restrictions for persons who have tests, pre-test and arrival tests. That there are enhanced restrictions in place now that were not there before.
Thank you. And another question, will the government quarantine facility reopen for those residents choosing to travel?
For those residents choosing to travel, I would strongly suggest that they do not travel. That would be the first instance. There is a consideration given to that. That is not something that is ready to be announced. There will be further things which may be announced on Tuesday at our press conference regarding additional measures for travel. And so we are looking into what may take place for persons and students who are coming back who may not be able to safely quarantine. But at this point in time, there is no government facility that is planned to be open. But individuals who are looking to travel, the government will be implementing additional restrictions regarding non-essential travel. And those will be announced. Additional deterrents, I'll say, and those will be announced hopefully by Tuesday.
Thank you, Premier. I just want to do a time check. It is 8:54, and we said we'll go for an hour, so I just wanted to do that. The next question, with a few people testing positive on day 14 now, is government considering an additional test day, for example, day 18, to assess whether the nature of COVID-19 is changing? Dr. Ayo?
Oh, right. Okay. Yes. No, we're not considering that. And so going back to the point we made earlier on that each situation is different. We think that there might be an exposure outside the travel for the people that we have seen testing positive on day 14. So we don't think that that's travel related. Certainly, the international evidence does not suggest that there is any value in testing beyond day 14, where if the exposure is primarily from travel. So the short answer is no. and we will not be going ahead with that.
Thank you. And just quickly looking for some more. So here's another question from the public. Has there been COVID spread in the churches? I thought churches were still on phase 4. Why implement further restrictions where people are still required to wear masks and physically distance, etc.?
What I would say is that we're just following an approach that makes sense in regards to vulnerable populations, persons that are congregating, and keeping it around. The fact is that we are not implementing a restriction of complete closure. That's not what we're doing. But we are implementing rolling back to the place where there was the 20% capacity. As I said, these measures will be revisited in the space of 2 weeks. It is particularly important that right now that we limit any possible, I would say, work of contact tracers. It is critically important that all persons abide by these regulations. We do not in any way, shape, or form relish or glory in them. It is, as I said, it is a particular personal challenge for me as the leader of the government that these things have to be reimposed. But I think that it's critical that we get a handle on what is clearly a spreading outbreak to make sure that we can come to grips and to put it in place. So last week, there were people who were saying the same thing about restaurants and bars, and we can see now the evidence that that is not the case. And so we need to be very, very, very careful on this.
Thank you, Premier. I'm just looking at the time. Do you want to wrap up with some final?
Well, we started about 5 minutes late, so I think we've got a little bit more time. Let us keep going.
Okay.
Let us do it for an hour, because I know there's a number of questions that are coming in.
All right. So I'm just quickly scanning. There was a question about public schools. Let me see if I can quickly find it. Here's one about the airport. Will the new airport be opening as scheduled on December 9th?
I am not entirely certain as to what may or may not take place with the new airport. I can't speak to that. I'm certain that we'll try to get an answer so people can get that update on Tuesday.
Thank you, Premier. And another question, is the government considering having the public school system go back to out-of-school learning?
At this time, that is not a consideration. We are going to assess the facts as they are on the ground. If there is information that comes to us that means that we would like to change that position, then we will. But right now, we are confident that we are in the correct stance. And I want to make sure that I make this clear, because although the numbers are, I don't want to say frightening, although the numbers are certainly surprising for many, it is important that we recognize that with our superior testing capacity in the country, we are able to detect and able to understand where these transmissions are. And because we're able to do that, because we're able to enact quarantine to test so many persons, is the reason why we are catching so many cases. A lot of these cases which are testing positive are people who are also already in quarantine. They're not necessarily people that are outside the community. So that is something that's important. So I know that the numbers themselves are concerning, but these measures are being taken to allow our contact tracers to make sure they can catch up, to make sure that we can put the lid on any particular spread, and so that we can get on top of that situation. I don't know if you wish to expand on that, Dr. Ayo.
I think you've captured it adequately, Premier.
Thank you.
I have nothing else to add.
Another question from our Facebook viewers, is the public transportation also reduced to 20% capacity?
Public transportation is in the exact same place where it was previously, so there are no further restrictions outside of the where it is right now. There is no change. And I think a bus can only hold 17 people anyways under current regulations.
Thank you, Premier. Will there be a choice for Bermuda residents to choose between the Oxford vaccine, which is a viral vector-based, versus the Pfizer vaccine, which is RNA-based, when both are available?
Well, going back to the point I made earlier on, the only vaccine that has received regulatory approval at this stage is the Pfizer vaccine. We don't know when or the Oxford vaccine is going to receive approval, and certainly that is not in consideration at this stage. When that comes in, we'll review all the evidence and prioritize appropriately. There's some evidence, very preliminary evidence to suggest that certain vaccines are better for certain age groups. Once we have all the data, that will form the basis of the advice that we give.
Thank you, CMO. Another question from a member of the public. Please address the bus situation. How often is it sanitized now with active local cases?
I think that there is a cleaning protocol that has been taking place, and I think that that protocol is working effectively. And if there's any questions on that, I'm happy to ask that individual. I will pass that message on to the Minister of Transport. We can make sure the answers are provided from the Minister of Transport.
Will individuals be forced to take the vaccine? And if not, what will be the ramifications?
I think we've answered that question many times, but go ahead.
No, exactly. There's no reason to force anybody to take the vaccine. I think there's enough reason for people to be motivated to take the vaccine on their own. If not to protect yourself, to protect your loved ones, and to protect people who are less able to cope very well with this virus. So I'm hoping that the better nature of Bermudians will come to the fore here, and people will be altruistic and take this vaccine when it's available.
Thank you very much. And another question from a member of the public: is the new WeHealth app catching any of these cases?
The new WeHealth app has not gone fully live. The WeHealth app will go live this Friday, as I mentioned in the House of Assembly on Friday. But it is important and essential that everyone go to their app stores and download the WeHealth Bermuda app. It will be critical in helping us to be able to reopen. It will be critical in helping to keep the contact tracing load down. It will be critical as we move forward. And so I would encourage all persons to go ahead and do that. As I had indicated, it is completely and 100% anonymous. When the app is downloaded, you do not have to give your name, your phone number, your email address, nothing. It is revolutionary technology that will be able to assist us as we move forward in order to try to make sure that this short pause is as short as possible. And Aderonka, with that, I know that we are basically at the time of ending. I don't know if the Minister of Health and or the CMO have any closing comments.
No.
Just to remind people that masks work. Please remember that masks work. Thank you.
Thank you very much. What I would say is thank you, Aderonka. I want to thank you and your team, the Department of Communications, for the excellent work of which you all continue to do, arranging things at short notice and making sure that we're able to communicate effectively to the public. There's a lot of people who say that public officers are sometimes they get a bad rap, but all I have to do is look at the team in the Department of Communications, the team in the Ministry of Health, the teams that are supporting the ministers around the clock to make sure that we can continue to serve the people through these difficult times. In closing, I just want to say to the country that this is not a place that any of us anticipated that we would be in. Without question, there are lessons to be learned. There are lessons to be learned by myself, recognizing some of the challenges which we've had. There's certainly a few areas that we need to tighten up on. But collectively, we all have to recognize that as a country, we thought the virus was gone. That is not the case. And certainly there is work to be done. I am confident, however, that if all of us do our part, we can make this pause a relatively short pause and we can return to existing the way that we want to exist, with restrictions in place, certainly, wearing masks, but being able to gather and being able to make sure that we are not transmitting the virus. The last place that Bermuda wants to get to is a place of community transmission. We are still at cluster cases. It is essential that all of our hard work and energy and effort over the past few months can continue to bear fruit. For those persons who will be affected by these closures, I am sorry. We will provide the support. The Minister of Finance is committed to provide the support, and the details regarding that support will be made available on Tuesday. I want to thank you for your attention. I want to thank the country for their understanding. This is a collective mission, and collectively, I know that we will get through this minor setback and able to return our